All right, good morning, everyone. Thank you for being on the call. It is Monday morning, July 20th, 9:02 a.m. I want to thank everybody for being on the call this morning. And again, we do these calls for you, so if you have any questions specifically that you'd like to hear answered, or if there's a topic that you really want to discuss or you think would be great for this call for yourself or even for your fellow agents, please let me know. You can send me a text message, an email, or give us a phone call, and I'll be glad to add it to the call that we do every Monday morning. There's a lot out there. I know there's a lot of information and a lot of changing parts, so I just want to make sure that, if you do have a subject that you want to get covered, I'm sure there's someone else out there that would love to hear it as well. So also a quick reminder, we are on YouTube, so these videos are being recorded, and just go out there, hit the subscribe button, and you can go ahead and get notified when we post a new video, so that way you can go back and all these calls are archived for you. All right, so training calendar, let's jump right in. Looks like a pretty busy week for training this week. Nothing today besides this call, but tomorrow at 11 a.m., Clover, which is a product in outside of Florida, we have in New Jersey and Georgia and Texas. Clover is doing their mandatory training classes, so this is a mandatory face-to-face. That's one of them. There's about 3 different trainings out there. So if you are selling Clover in your market, please make sure that you complete not only the online training, but the mandatory face-to-face training, which is online, so it's not really face-to-face. But there's a special class that you have to go to, log into, and be on that call. So that's tomorrow. The first one's tomorrow at 11 a.m. Also tomorrow, the 21st, Humana is hosting a training called Building Connections and Meeting Your Clients' Needs. So that is at 1 o'clock on Tuesday tomorrow. On Wednesday, trainings in the afternoon. There's 2 trainings at 3 o'clock. The first one is hosted by Humana, and they are doing the dual basics and Medicaid. So if you're not familiar with Medicaid and how the plans work with Medicaid, this would be a great training session for you. Again, that is Wednesday, the 22nd at 3 p.m. Also, same time, Humana is hosting another training for tips for virtual sales presentations. And as the world gets crazier and crazier, as we see a possible second lockdown and people are talking about, this virus going into the fall, I think it's absolutely critical that you know how to do virtual sales presentations. So if you're not familiar on how to present virtually and the compliance behind it, which is very important, you don't want to catch yourself off guard. Make sure you're doing it right for not only yourself, but for your clients. This would be a great training for you. So again, that's Wednesday at 3 o'clock. Thursday, Melina is doing a Medicare Enrollment option training. That's Thursday, the 23rd at 10 a.m. So everyone's moving into those EAP systems like I just explained. And this is a good training for you to get brushed up on for Melina Medicare. Also on Thursday at 11, Clover is doing another mandatory certification class. That's the 23rd at 11 a.m. On Thursday the 23rd at 1 o'clock, there is a Humana completing enrollment virtually. Again, another enrollment training class for EAPs, and that is at 1 o'clock on Thursday. But the training of the week, the one that I would say don't miss this, absolutely should get on this one, is Health Sherpa enrollment training. If you're doing ACA business, Obamacare, individuals, family, insurance, this is a class you should be on this week. And again, it's Thursday at 1 o'clock, and we'll be going through how to use Health Sherpa to do your online enrollments. And I can personally tell you that this enrollment software is awesome. It's completely free to you. We'll get you set up on it. If you don't have ACA Health Sherpa set up, please let us know, and we can go ahead and send you out the link so you're ready for this training on Thursday. So just shoot me an email. I'd be glad to send you out that training link, as well as the link to get set up with your Health Sherpa account. But as we move into open enrollment in November, you're going to get a lot of quotes. People are going to be asking you about Obamacare, ACA, individual, family. don't leave money on the table. This is the time to do health insurance, individuals and families. I can't tell you of a better time right now than to do this product. I mean, there's so many people out there that have lost their jobs that are looking for health insurance. And literally, if you're posting on Facebook or Instagram and letting people know that you do health insurance, you're going to get leads like crazy. We did a test run over the weekend, and I saw the results. I mean, people are asking questions. They're going out to get themselves a quote. So this is a full, you can send out links. People can quote themselves. And if they do the enrollment, you get full credit, which is like free money sometimes, right? So that Health Sherpa enrollment training will teach you about the software on Thursday at 1 o'clock. So don't miss that training. And then lastly, on Friday at 1 o'clock, Humana is hosting a training on how to care for your book of business after the enrollment process. And again, this goes all the way back to why are we in this business? We're here to service our clients and make sure that their health care needs are met. You are their advocate. And this is going to teach you on exactly what you need to do to make sure that your book of business is happy and they're getting the health care that they need. And also, believe it or not, this is the #1 way that you will grow your book of business is just by tending to your book of business because of the referrals that you will get from it. No matter how much money, no matter how much marketing, no matter how much advertising we do as an agency, every month, month in and month out, the #1 lead source is client referrals. And that is a testament on how great a job you guys are doing. But I don't want you to lose focus on that, and that is important to make sure that you're calling your book of business, you're sending them text messages, you're sending them letters, you're adding them on Facebook. I mean, there's so many different touch points that you can do to get engaged with your clients, and they're going to teach you that on Friday at 1 o'clock. So that is the training for the week. And again, I know you've got to slip these trainings in and out of your certifications, your recertifications for all the carriers. They have started coming out with the 2021 certifications. In fact, I think almost everyone has launched their 2021 Medicare certifications. The ACA training for the Affordable Care Act is not yet out, but we will have a date shortly. And so then that will be added to get you ready to sell for individual and family plans. But it's very important that you carve out time, at least right now, doing at least 1 certification a week. That should keep you on track for open enrollment. But if you have time, if it's a little bit slower for you, use that time to get your certifications done and out of the way. Now, if you need help with your certifications, meaning that you've gone through all the modules, you've taken the test 1 time and you did not pass. If you need help, we are at the office Monday through Friday, 9 to 6, and we will be happy to help you and guide you on taking that second test. So hopefully we can guide you and review the materials and review the test to ensure that you pass. So please don't try to do it on your own. Do not try to do it the 3rd time, especially because if you don't pass on the 3rd time, a lot of these carriers will lock you out and they will say, we'll see you in 2022. And so you don't want that to happen. We're here to help you. We're here to guide you. We're here to ensure that you do have the ability to pass these tests. We're here to guide you for that. So if you need help, reach out. That's what we're here for. Reach out and we'll be able to assist you as best we can. A couple of updates here. Simply Healthcare is now rolled out their direct deposit system. You can go into your portal at Simply and you can sign up for direct deposit yourself. It's a self-service. They just rolled that out last week. So if you have not yet set up your Simply Healthcare commissions to be paid directly to you, you can go ahead and log into your Simply portal, and you can go in there and you can set up your direct deposit. If you need help, you can reach out to Tony at Simply Healthcare. Again, if you don't have his number, you can reach out to us and we'll be glad to assist you in connecting you with Simply. or you can call their broker support line and they'll walk you through on how to get to your portal, and so you can get that direct deposit set up. They're one of the last ones left, so that way I don't have to cut your checks anymore, which is a lot of work. So you definitely go out there and get that set up so you can get your direct deposit, you get paid faster. Ambetter has a brand new marketing portal, and this marketing portal, you can go in there and you can create marketing materials like flyers and postcards and even social media posts. So go in there, check that out if you're selling Ambetter. Again, with Obamacare being as hot as it is right now, you can quickly make a marketing piece, get that set up, and get it blasted out to your Facebook page. Or if you want to print out flyers and go out, to restaurants or hair salons or wherever, make sure you wear your mask, of course, but you could drop off flyers and say, hey, I'm just here to leave flyers for healthcare information, and hopefully that makes your phone ring, and you can do those enrollments. You'll learn how to do those on Thursday over the phone, entirely over the phone and by email, which is awesome. So, take advantage of those marketing portals and get those materials created. And then just a little side note, Cindy has found a volunteer mission that they are doing in Volusia County. So they are looking for volunteers here locally in Central Florida. So if you are interested in participating, for those in need, there is a volunteer ask in the Volusia County market. Now, I mentioned volunteering because I used to do volunteering. And number one, it feels great to help people in need, and the community really needs help. There's not a lot of volunteers out there, and it's a great way also just to let people know what you do. You're not there to market, but I always used to wear my shirt, like my Healthline Market shirt, and I'd go out there and people would ask me, what do you do? And I'd tell them, and that way people know that you're there in case they do have questions. You're not there to sell, you're not there to market. But it's just connecting the community, and volunteering is a great thing, whether it's packing up bags or sweeping up or cleaning or whatever they need you to do. I was lucky to do some cooking one time. That was fun. But it just depends on where they need you and what your skills are, but they do need volunteers. So look around your community if it's not, in Volusia. But those of you in Volusia County that would like to do some volunteer work, shoot over to Cindy, and Cindy has some more details on that. But everyone else, if you're interested in doing volunteering, don't be afraid to ask my best friend, Google. He'll tell you exactly where to go if you're looking to do some volunteer work. So I hope you guys do that. All right. Again, I'm going back into ACA a lot here because I really see the numbers are picking up. People are asking about individual health insurance. So if you haven't done it in the past, I really highly consider that you reevaluate that and get contracted with ACA products. Right now, we are bringing in Molina Healthcare, so we will have Oscar, we will have Bright Health, we will have Ambetter, and we will have Molina as options on the ACA side to do health insurance and help our community connect with doctors and hospitals and prescriptions. So if you haven't done that, go out, talk to Jessica, and she'll tell you exactly what you need to do to get ready to sell for 2021 ACA. Get out there, help people, and make money, make lots of money, so you can go volunteer and hopefully give some of that money back into the community. All right, deal of the week. This week's deal is car magnets. If you do not have a set of car magnets, please reach out to your Healthline Markets rep, whether it's Kim or Cindy, or your manager, and we will be happy to set up some car magnets for you. I know we're not driving around a lot like we used to, but this is just a prep for open enrollment. And I know some of you will still be doing face-to-face appointments, and that's, per your clients. If your clients feel good about meeting in person, then absolutely. If you feel comfortable with it and your client does and you want to meet face-to-face, you got your mask on, you sit 6 feet apart, whatever the case might be, you want to make sure that you're prepared. So car magnets. I've seen people tell me stories on how awesome car magnets work. We had an agent one time, the first day, put them on her car, drove to the Starbucks, and got a lead. I mean, just like that. And since then, she has never taken them off her car. So, it doesn't work right away like that, but that was one great example. Sometimes it takes a couple of weeks or maybe even a couple of months before you get a phone call. I personally used to drive around with car magnets, and I have clients from car magnets. They just, I was driving in a neighborhood and they called me and they said, I saw your car magnet. Can you help me with my Medicare? There it is. So we do have car magnets available. So if you are interested in setting that up for yourself, just reach out to one of us and we'll get that taken care of. Now, last thing on my agenda, so this is kind of a quick call this morning. I'd like to talk to you about what's happening. One of the biggest things that's happening in the Medicare arena this year is those folks that have end-stage renal disease or ESRD will now be eligible to join Medicare Advantage plans for the first time. So this is a really big game changer, but I will tell you that we have to be very careful on how we enroll these folks and who we enroll. Just because they have ESRD, just to clear the air, these are going to be folks that have original Medicare A and B. So unless they have another special need like diabetes, they will be eligible for the core plans, and you can start doing those enrollments on October 15th through December 7th. So those folks will now be eligible to join Medicare Advantage for the first time. And when you enroll them throughout AEP, then they'll be eligible to join on January 1st. So no more do you have to turn people away. If you come across somebody between now and then, you can say, hey, look, it looks like you might be a good fit for Medicare Advantage, but I won't be able to share with you the information until October, and we can get you set up with a plan as early as January 1st. But those folks are now eligible for Medicare Advantage plans for the very first time. In fact, I think that question is going to be taken off of the actual applications. So you have that. Now, I do want to talk to you about who is eligible or who is a good fit for Medicare Advantage when they have ESRD. Number one, I think that it all boils down to compliance, and that being, what are their needs? Number two, what are their needs? But the compliance is, if they go see their doctor on a regular basis, they take their medications, they go to their appointments, and those are what you call compliant patients. But if you have patients that, use the emergency room quite often, go to the hospital a lot, don't really see their primary care doctor, they don't take their medicines, then that's a non-compliant patient, right? And as you start to talk to these folks, you're going to kind of get a sense of that. Who is non-compliant and who is compliant? If they're going to dialysis 3 days a week and they're taking their medications and they're going to the primary care doctor and they're trying to stay out of the hospital, that would be a good fit for Medicare Advantage, Now, on non-compliant side, the exact opposite. If they're just running around and they're not doing what they need to be doing, then those folks would probably not be a good fit for Medicare Advantage. Leave them where they're at on original Medicare, or even maybe a PPO product or a supplement if you can get them on there. It all depends on the situation, but you do have so many flavors of Medicare Advantage. But one question I was asked last week is, are there going to be specific plans for people with end-stage renal disease? The answer is not that I've seen for this year, but in other areas of the country, such as New York, there are specific plans designed for people with ESRD. So I do see that becoming a trend in the future, especially because these people are very high risk. Medicare actually pays the health plans additional money to take care of these folks. So that's why it's important that they're compliant or non-compliant. You don't want to put the wrong person on this plan for the wrong reason, right? Not just to make a commission. But remember, guys, your purpose is to help the community. You're not here just to make a commission. That comes with it. But if you do a good job, I think you won't really have to worry about that. So as you're talking to folks, just make sure that you're keeping that compliance there. And then number two, what is their needs? you know, take a look at that. Now, if they have diabetes, for instance, or they're also Medicare, Medicaid, make sure you're putting them on the right plan. You know, it's a D-SNP for Medicaid, it's a C-SNP for chronic conditions. But moving into next year, if you had a bunch of people that maybe over the years you talked to and they had ESRD, go back through your notes and find those people and give them the good news and say, hey, look, we need to have a conversation about your health care because you may be eligible for some additional benefits that you didn't have before. And so again, if they're compliant, great. If they're not, you know, maybe it's best that they stay where they're at. And then share with them all the flavors. You've got HMOs, you've got PPOs, you've got C-SNPs, you've got D-SNPs. All of these products are out there to serve the folks depending on what their real, true needs are. So that's what I wanted to share with you today. With that, again, kind of a shorter call, but I do want to open it up for questions. So if you have questions, I'm going to unmute everybody. Just make sure you mute yourself if you've got background noise, so that way everybody can hear you on the call. So with that, I'm going to open it up. Does anyone have any questions this morning?
Yes, sir. I have a question.
Good morning.
Good morning. Listen, when you talk about compliance in the Medicare Advantage plans, you said that if the beneficiary is not, maybe it's better to to stay in you know, original Medicare, you said, or a supplement. But what about a PPO? Because a PPO, those beneficiaries that are enrolled in PPO, they need also to be compliant?
Less so, but yes, I think you make a great point there. A PPO product would probably be a very good fit for those folks. You know, I would say you kind of have to gauge it. You know, if they're somewhat compliant, maybe in the middle, then maybe a PPO would be a good fit. But yeah, PPO would definitely be safer than an HMO because when they're on an HMO, both the health plan and the primary care doctor are on the hook for that member. They're the ones that have to pay the hospital and the dialysis service and the specialist. So yeah, you make a great point with that. A PPO could be a good fit for those folks if they're somewhat compliant or maybe less compliant. Absolutely.
Thank you.
You got it.
Good morning, Justin.
Good morning.
Good morning. It's Mary Bull up here in Long Island.
Oh,
okay.
Yeah.
So yeah, I have number 10 grandson and number 9 here. But,
congratulations.
Thank you. Wait a minute. Okay. I was just wondering, this end-stage renal disease, you bring up that they're on original Medicare, and do they have a supplement that they're paying for, like a Plan F or?
Well, most of the time these folks are just on original Medicare when you meet them. So a lot of them don't have anything but Medicare A and B. And the reason being is because they were denied a supplement because of their pre-existing conditions. And then Medicare Advantage plans, they weren't allowed on them before. Now, as of January 1st, they're able to enroll into a Medicare Advantage plan. So these folks will, for the first time, be able to join some type of health insurance plan through the Medicare system.
Okay, thank you. I just didn't know if they had a circumstance that somehow they were able to get, you know, a supplement as well. So thank you.
Well, yeah, one thing I will say is if they've developed end-stage renal disease while they were already on a plan, because sometimes we run into that. Like, for instance, maybe they're on WellCare, and then years later they develop ESRD. That also happens. So in that situation, they have to stay on WellCare or they can go to original Medicare. That was their only choice. So you may come across people that are already on a Medicare Advantage plan or maybe already on a supplement because they enrolled prior to having been diagnosed with ESRD. So there is a possibility that some of those people are running around, but they couldn't change before. So now they're able to change their plan if they choose so.
Justin, I have a question.
Yes.
Along those lines, but we can change them also from a Medicare Advantage to another Medicare Advantage?
That's correct. Yep. So
Okay.
as of in open enrollment, so in AEP, starting October 15th, you can take applications for those folks and start them up on January 1st.
Got it.
Mm-hmm. Great questions.
Hey, Justin. Hi. Good morning. This is Tony from New Jersey. How are you, sir?
Good morning. Good morning. Very good. How are you?
Very good, thanks. I just have two quick questions. You know, I was on the website on Jarvis there trying to find out about ordering, excuse me, materials.
Mm-hmm.
And I don't think you're able to order them quite yet, although you can get on the site. But they list a bunch of product codes like H1234, and the list is pretty extensive because it covers all of New Jersey and all the plans they have.
Mm-hmm.
Two things, actually. Excuse me for my sore throat, not sore throat, but tickle. Anyway, when are we able to order the materials, number one? And number two, can we get a list of the product codes and what they represent? In other words, so if it's H1234, this is Medicare Complete Plan 1, and so forth and so on, so that we don't have to scroll down and guess which corresponds to the product code for the right plan we want to order. It would save a lot of time if we could get that, I think, and the date on when we can order stuff.
Absolutely. So I'll answer the first part is when can you order, and the carriers are slowly letting us know when that you can start ordering sales kits. So I can tell you Humana is live right now. I know United Healthcare, I think you can go in there and order some of those sales kits now. But it depends on the area too. So some areas are ready and some are not. So we'll let you know once the sales kits are available. I'll start putting that on the Monday call as we start to get these notifications. But when you go in there, the first thing I would do is just make sure you know what you think you're going to need. And I know it sounds kind of crazy, but based on your past experience, how many kits do you think you'll need in open enrollment? Let's say you did 100 enrollments last year. So you know you're going to need about 100 kits here, give or take. And then break that down by carrier. How many sales did I do for United? Well, maybe I did half of those sales with United, so I know I'm going to need 50 kits. And then take a look at the product span. Was it mostly core plans, or was it mostly PPOs, or was it mostly, because that trend will kind of help you gauge, how many kits you're going to need by which carrier and then what product designs. Now, I know that there's new carriers or there's new products designs coming out. There's new plans coming out. So we'll keep you abreast of those things. But as the plans start sending out their first looks, you'll have the opportunity to see in that PDF, they're sending out those first looks, you'll have an opportunity to see what products are in that first look. So I'll start sending those out to you, Tony, so you can dive in and you just scroll down to New Jersey and then you'll see the plans, all the plans, and then next to the plans we'll have the plan codes. So that way you'll know, okay, I see there's a new PPO in this area. I think I'm going to need about 10 of those, and you should be able to order from there from the plan code. But if you need help with that, if you can't, if it's confusing, because I personally haven't been in there yet, so I don't know how crazy it is. But if you need help ordering kits, just let us know. We'll be glad to jump in there with you and help you out.
Thank you very much.
Justin,
you got it.
Justin, it's Tom. John and Sergio and I, it's our intent to put the ordering instructions for material for all the major carriers. We'll put it up in the Gold Key.
Outstanding. Thank you, Tom. So as we get those ordering instructions, they're going to load those up into the Gold Key, and then we'll send out a notice to you guys so that way you can dive in there, and you'll have step-by-step guide on how to get to those orders. So appreciate that, Tom. Thank you very much. Okay, and then just a note on sales kits. We're gonna continue to have sales kits at our office, but because of space, we are going to be limited, especially when we're adding a couple of new carriers and new plan designs. So we won't have everything all the time. So with that, number one, right now, do an inventory. What do you think you're going to need for the rest of 2020? Let us know, or get those orders done for 2020 so you have enough kits to last you from July until December for anybody that needs to enroll in 2020. Clean house, if there's kits that you don't need or you don't think you're going to need, go ahead and, pass them off to another agent. or you can bring them into us and we'll get them out to an agent that's selling those products. And then number two, you know, like I was telling Tony, do inventory for your 2021. How many kits do I think I'm going to need? And break it down by carrier. And with that, we want you to try to do self-order. We want you to order directly. It's going to be faster for you. It's going to be more accurate. You don't have to wait for us. And it goes straight to your house when you do those order kits. So that way you can prepare and be ready for that. We're going to kind of treat this as, you know, hey, I ran low on kits and I have a client tomorrow or the next day. Can you send us kits? Can I come into the office to pick them up? Absolutely. You know, we're going to have those opportunities. But keep in mind that it is first come, first serve. So if we're out of a certain plan, we're out of a certain plan. And so that's why we want to make sure that you guys are self-sufficient on your orders. All the plans are making it a lot easier this year to place those orders online. So again, go in there, place your orders, and get them sent right to your front door. It's just going to be easier to do it that way. All right. Any other questions for me this morning?
Hey, Justin, a quick question.
Yes, sir.
This is Will. I was reading somewhere, I don't know, it seems that I've got to pull up the article because I don't have it right in front of me, but is it permissible to go to those places for, you know, dialysis clinics and so on and so forth without, just to leave information, you know, for the...
Absolutely. Yeah, so that's a great question. You know, if you are interested in marketing to those people that have ESRD, you know, nothing's off the table. You're going to follow the standard Medicare rules. So if you're doing a tabletop and you're going to represent, for instance, you know, WellCare, you just need to make sure that you file that event with WellCare and you have WellCare materials there at the front. And again, that's if they're, you know, they're saying, yeah, well, you can set up a table out front here. We have no problem with that. You can do that. There's nothing wrong with that. You just got to make sure that you file it as a sales event. If you're there doing educational, like for instance, if they give you the opportunity to do an educational event about Medicare Advantage in general, not talking about specific benefits, that's an opportunity. You can do that, and that is an educational. You do not need to file that with the health plan. However, if you're using their materials, if you're using their logo, then yes, it does. But we have HPM generic things that you can use. We have a generic presentation. We can help build that out for you. You know, your polo shirt, your tabletop, all that stuff we have available, so you can do those generic things. But yeah, you can go in there. You can leave flyers about the Medicare plans available. And just another thought, you know, everyone goes after the primary care doctor, but don't forget about those specialists, and specifically people that have ESRD, you know, the nephrologist, that's your kidney doctor. Those are usually the people that sign off and say, yes, this person has stage 4 and, you know, renal disease, and that's the person that actually signs off. Now, another quick technicality in there, most people that get disability or Medicare early before 65 have to wait 24 months or 2 years before they actually get their Medicare card. But with ESRD, once they're diagnosed and Medicare receives that diagnosis, they get their Medicare card in 60 days. So they get it faster than a traditional a person that has just a disability, a regular disability. So, you know, there is a marketing opportunity there, but I would just caution you guys, you know, if you're out there and talking to these people that have Medicare, do what's right by them. You know, if they're non-compliant, if they're using the hospital a lot, maybe just stay away from them or put them on a PPO or whatever the case might be. But if they are compliant, they are following those directions, then an HMO would be a great fit for some of those folks too. But absolutely, you could, and that could be part of your AEP goal, is maybe that you're starting relationships with dialysis centers, and there's a lot of them out there, and a lot, you know, Medicare agents never used to go there. But I would also, you know, quick tip, maybe a $10,000 tip here for you, nephrologists. You know, nephrologists, those folks that deal with the kidneys. So, great point, absolutely great point. But yeah, just follow the standard marketing guidelines, and you're okay.
So bringing donuts won't be a good idea, right?
Well, I'm not sure how that responds to kidney failure, but probably not better. Probably don't bring donuts to your endocrinologist, not to the diabetic side. But yeah, I mean, right now, if you're going to visit doctors, you know, I mean, I used to go to Publix and get those big bowls of fruit, those fresh fruit for the office, or a veggie platter, or something like that. That always went over pretty well too. So yeah, get creative, but definitely this is a great time. If it's a little slower, go out there and start those relationships and let them know that you're out there and you can help people with their Medicare.
Yeah, good. Good. Thank you.
You got it.
Justin, it's Mary. I went around to all of those dialysis places in Volusia County, and they told me they all have corporate, that I can't leave anything, couldn't do anything. So that was just my take on it.
Yeah, some of them are going to be more open to it than others, and you're right. You know, it's their business, it's their building, it's their customers. But you know, if you can really just, you know, if you're willing to go out there again and try, I would look for those smaller ones. Maybe, you know, DaVita I know is a super monster in dialysis centers, but maybe not the dialysis center, but maybe the nephrologist, you might have a little bit better luck because those are less corporate-y. You know, they're willing to work with you on that. But yeah, you're right. Some of those dialysis centers are like, look, I can't do it. Corporate won't allow me. But just let them know, hey, look, I have information about, you know, Medicare products for the first time they're going to be eligible. Can I leave some flyers here at least? And a lot of the times they'll let you do that at least. But it all depends. You're right. Some of them are not going to want anything. It's just the way that it works. But try your luck at nephrologists. That might be a better idea for you.
Okay. Good point.
All right, guys. Well, thanks again for being on the call. Just remember that I am recording these calls. They are on YouTube, so go out there, subscribe. Make sure that you have your notification on, so when we release a new video, you have it at your fingertips and you're ready to go. So with that, I hope everyone has a fantastic week. Go out there and help people get their health care taken care of. We appreciate it. Have a fantastic week.